My son Caden came into this world with a lustful cry for life. Yet by the time he was 6 months old, he had lost the ability to hold up his head, to roll over, or to make loud sounds. Doctors originally put it off to him being a little bit premature, but diagnostic tests by neuromuscular specialists showed that Caden had a neuromuscular disease, spinal muscular atrophy, for which there is no treatment or cure. We were told at the time that we would be lucky if he lived to the age of 2. Thankfully, at this point, we can say that he's defied all odds. He's just graduated from high school, and he is preparing to go to college. When you receive a diagnosis for a disease for which there is no treatment or cure, you seem to manage life from crisis to crisis. You quickly learn to discern between the good doctors and the great doctors. You know when to stay, and you know when to walk away. You see, the great doctors go beyond diagnosis, usage of medications, and standard treatment procedures. They draw on the full spectrum of their capabilities to provide compassionate care. They understand the importance of the human connection. You see, the great doctors have graduated from medical school and residency without losing sight of their most important faculties, and that is remembering that the best care is patient-doctor care. There is a commonly held perception by many in medicine that if you feel strongly connected to your patients, your judgment is clouded. But research indicates that emotional attunement can actually improve critical thinking, decision-making, and the ability to act quickly in crisis moments. When patients see that you truly care, they can trust you enough to tell you the truth. And more importantly, they will follow your advice. So a healthy patient-doctor relationship is a prescription for success. And as a mother of a disabled child, the wife of a doctor, and a former director of public relations at a hospital, I have come to believe and to know that great doctors listen, they observe, and they communicate. They know that healing isn't just a science, it's an art. Healing involves the heart, the spirit, the mind, and the body. I couldn't tell you if the great doctors I know received A's in medical school or how they did on their boards. I don't know if they were the lead residents or not. The doctors that I know, who I've trusted with my son's life and I have come to respect beyond measure, know Caden by his first name, and they know me too. We are a team. They value my input as much as I value theirs. We've overcome many life-threatening challenges together. We don't have all the answers. We even make mistakes. But I'm grateful to say that Caden is living proof of the importance of our relationships. There is a movement among medical schools across the country to offer an elective called the Healer's Art. I wish all medical schools would offer this elective. In fact, I wish it wasn't an elective. I wish it was mandatory. This class allows students, doctors, and their teachers with patients to sit down together and talk about their struggles in practicing the patient-centered care model. I wish there were more opportunities for patients and their parents to get involved. That's where the PACER program with the University of Minnesota comes into practice. I am so honored to be able to have had the opportunity to participate. I think that the PACER grant makes it possible to build bridges between patients and residents and their parents. And that's good medicine. It is something that gives patients and their parents the opportunity to help shape great doctors for the future. So thank you to PACER and to the U of M and to the residents for investing more in their patient and doctor relationship. You're onto something, and it's something great.